One of the greatest challenges facing the Mexican health system is to be prepared for the phenomenon of an aging population. According to the last census conducted by the National Institute of Statistics and Geography, during 2015, approximately 10 million people were older adults, representing almost 9% of the total population in Mexico. In the same way, the capital Mexico City has 14% of older adults, and because of its own complexity, it is a city with profound inequalities. However, we decided to work with the elderly of Iztapalapa, located in Mexico City, which is the most populated municipality in the country according to its density of population, characterized as one of the poorest and most marginalized districts due to the lack of access to public goods and services. In Iztapalapa, the 12.5% of the total population are elderly people and they live in high vulnerability conditions. It should be stressed that aging should not be seen as a burden of the health system or a funding problem, but rather as a good opportunity to reorient public policy and provide new meaning to old age, elderly, and aging.
Our main goals are, first, offer a space where elderly people can provide workshops through which they can earn income at the same time that their empowerment and activation is promoted. Second, convene and train volunteers through an online course to coordinate a workshop and help elderly people to prepare their own. And third, offer an online course for both elderly people and volunteers about general gerontology and health promotion topics in order to raise awareness of the importance of healthy aging.
Our proposal starts with designing and preparing a massive open online course repository delving into general gerontology and health promotion topics. We intend to bring together a team composed of experts in health promotion, adult learning, and gerontology. These courses are intended to be taken by both older adults and young volunteers. We propose the following topics. Bear in mind that this is not an exhaustive list. First, health promotion and prevention of disease in both the elderly and the young. Second, ageism, its role in the limitation of mobility and functionality in older adults, and how to improve intergenerational communication and relationships. Third, determinants of health looked at from a life course and ecological perspective, and how to address these issues to ensure future generations reach a healthy old age. Fourth, empowerment of older adults to transform their physical and social environment through adult learning, andragogy, and improving self and peer-to-peer teaching. The next step encompasses the creation of materials for training volunteers to 1. Be counselors or guides to help older people start or improve their use of the technology available to them. Second, to help older people identify skills they can turn into a workshop and to work together with other people to strengthen these workshops. 3. Translate the content of the MOOCs to face-to-face workshops. Next, we seek to establish a well-defined space in which older adults can partake or impart these workshops. We envision these spaces as places where older people can thrive socially and either improve on lost functionality or delay its loss, while giving them spaces where they feel empowered. Mexico City, and namely Iztapalapa, already have spaces dedicated to culture and community engagement, called Pilares, and Iztapalapa has a unique cultural parks program called Utopias. We think these places might just be ideal for starting a social program like this one, and they may pave the road for opening even more communal spaces where everyone can get empowered.
Public communication could be a key component for this project. A strong strategy on social media and networking with NGOs and government agencies could be needed. Currently, we have contacts that could help us spreading the word about our project, to seek for young volunteers that are willing to give some of their time to improve the health and life of the elderly. But our target population are not equal and could not be treated the same way. So our recruitment strategy has to adapt to the elderly as well. Field work would be essential. Direct invitation in asylums and health facilities are a good start, as well as massive media campaign like radio or newspaper that people this age are more willing to look after.
The fifth activity consists in providing medical attention to older adults at the locations where they offer their workshops.
This medical attention will be provided by teams composed of a geriatrician doctor and geriatric residents.
We will work in coordination with their institutions of origin to transport them to each Utopia and Los Pilares Center, so that the older adults that are there
Receive care once a month in medical care stands that will be installed with the help of the volunteers the days that health teams visit the centers. The short-term objective for this activity will be to evaluate older adults' general health and transfer them to other specialists if necessary. The long-term objective will be to provide continuous medical care to the older adults who are part of the program and monitor if there is an improvement or maintenance of their physical and mental functions.
With this project, you expect to reach and engage almost 900 elderly in the first year in the 30 cultural centers across Iztapalapa municipalities. We expect them to complete the course Healthy Aging and become workshop facilitators in their communities, teaching activities and hobbies they find passionate. Consequently, we would expect them to regain personal contact and community engagement and to shift society's perception about the elderly self-sufficiency and self-care. We also expect to have an integral impact on health determinants. These approaches include geriatric healthcare under community centers, risk-reduced frequented areas, and economic support for commute expenses. We expect them to improve their well-being, especially mental health, and maintain or increase functionality. There are other 40 planned centers that we also consider on each segment's yearly expenses. We foresee an annual increase of participants and to expand the healthcare team as well. Once the project is evaluated, we expect to reproduce the program to other municipalities within and outside Mexico City.
To measure the impact of our program, we will use primary and secondary indicators.
What we specifically want to measure with primary indicators is the participation rate of older adults, volunteers, and the general public in our health aging online course, as well as the participation of older adults and volunteers in the other phases of our program. An example of this type of indicator that we will use is participation rate of older adults that imported at least one workshop in the previous 6 months.
On the other hand, what we want to measure with secondary indicators is self-esteem with Rosenberg's scale and quality of life with World Health Organization scale for older people before and after their participation in our program,
as well as an improvement in their functionality as part of the integral evaluation by health personnel.
We have varied our vast strengths, but we have also identified some areas of opportunity. One of our biggest challenges would be to face the disappointing reality in which some families sadly consider including the elderly in new projects as a waste of time. Transforming this mindset would be a wall to climb. Our target population has also some issues due to connection and accessibility to transport, use of technology, and sometimes health and communication barriers that need to be solved in order to achieve better results. Convincing stakeholders that this is something worthy to invest in represents one of our hot topics in this matter. In general, vulnerable communities that do not generate any profit have always been left behind, but we have the chance to start a revolution of ideas and actions.
The total budget comprises $2 million and we itemize them yearly in 5 main segments: online courses, communication, spaces, healthcare, and economic support. We consider the increase in center numbers and elderly workshop facilitators, a 3% annual increase in media costs, and the healthcare team commute to each assigned Iztapalapa area. The budget percentage used increases yearly starting at 14% and reaching 25% in the 5th year. Online courses receive 1% of the total budget. It encompasses 5 professional teams for the courses development, licenses, website domain, and database access. Communication received 14.5% of the budget. It was divided into strategy directed towards the elderly, consisting of a matinal commercial spot, radio spots on 8 broadcasting networks, newspaper publicity, and signs on Iztapalapa subway and markets. Billboards and social network advertisements focused on volunteers. We save 10% of all the budget for infrastructure modifications such as handrails or ramps as required in the centers. Healthcare, 23.8% includes commuting for medical facilities to assigned cultural centers, a daily meal, and temporary clinical stands. Economic support measures include almost half of the budget, looking to strengthen the municipality's elderly support for those who participate and remain in the program.